wanted to thank all four of our presenters. So Dr. Kevin Lee, Associate Professor Danny Hitch, Dr. Todd Davenport, and Dr. Soraya Katapan. Um, and just share some of my insights. Now, I don't pretend to have followed along with all of Dr. Lee's presentation. It was very medical, but certainly I took away from him one of the things that I've certainly come across with people with ME being assessed medically and then being told that they were fine in terms of blood pressure and heart rate and so on. And he was explaining to us why that might well be the case and why often people with ME have not necessarily been understood by medical professionals because we're only just finding out now how to actually understand blood flow and the impact on the brain. So I thought that was really interesting what he was talking about. Danny was talking to us about the overlap between long COVID and ME, and I think there's a lot to learn there, but very big similarities in terms of the high level of disability and the low level of a low quality of life. And she was also talking about that the impact of gender, which I think is very key to both long COVID and to ME, where we know women are more likely to experience both of these conditions and also more likely to experience that gaslighting experience. Then Dr. Davenport, again, I don't pretend to have followed all of his presentation either, but certainly what I took away from it is that he was talking about the fact that people with ME are not just experiencing deconditioning. And that's something I remember back in the 90s that was often talked about in terms of that people with who were taking extended bed rest, it was called, were actually deconditioned. And clearly the science does not support that. The completely different processes happening for people with ME. And I know it'll warm the cockles of Rachel's heart for him to be talking about the international consensus criteria and how important that is since 2011, that's been a compulsory part of diagnosing ME through the importance of PEM or PENA. So, I think that's key to being much more exclusive about the diagnosis of ME and much more accurate rather than it being very broad. We're still talking about a spectrum of disease, which is what he was talking about, but he was talking about people with ME being reliable and credible reporters in terms of their symptoms. That this is the science is backing up people's experience. And then Dr. Soraya Katapan talking about telehealth, and I think really crucially talking about involving people who experience the condition, whatever it is, involving them in research and as research partners to actually look at increasing trust with telehealth, because telehealth is obviously hugely relevant to people with ME because we know that people often don't have access to health services, they're not able to, or they've experienced they've had quite dismissive experiences in the past. So I think some really key points from all of our presenters. And I just wanted to say as well, just another reminder that if anybody wanted to make any donations in appreciation of this free webinar, then that would make us very happy. But thank you very much for attending and for participating either as a presenter or as part of the audience. So thank you very much.